don't have to protest ourselves.
All right, Dr. Brown, Dr. Yama's in the building, ladies and gentlemen. All right, what did you want to touch on today, Dr. Brown?
Well, I'm glad you asked. You know, I always got something I want to say. The COVID-19 treatment guidelines came out April 21st from NIH, which I think are real important. I can just touch on a few things, and then if y'all want to talk about more stuff, we can. But I think the most important, well, there's a couple of important things. First of all, right now, I mean, these are the treatment guidelines that came. Oh, I thought you was ready. Well, the treatment guidelines have a lot to do with, you know, so many things. It's not just the medicine, but that, and then obviously the governor opening back up the state and what that means for people. So I think, yeah, just honing in on that of really what it means, what's going on right now, so people are abreast, and then that way they can make good decisions about going to get their damn hair done.
As always. Yama, are you speakerphone today?
I am. Do I need to get on my little thing?
Yeah.
Okay.
I went back again.
You getting feedback?
Back into the microphone.
Is that better? Thank you. Hey guys, how are y'all? Mm-hmm. Okay, so you're right. The COVID-19 treatment guidelines came out from NIH April 21st. So I need everybody to realize these are like the best minds that we have all around the world. Okay, so that's one key thing. That's the reason why I'm talking about it. Otherwise, I would not quote it. So one thing's for sure is that there are no recommendations at this time for people to take anything for pre-exposure other than what we talked about, right? To boost our immune system. I still recommend that regardless of whatever they say. But a couple of things to keep in mind, and I won't go to too much into the hospitalization and all that because we all know those things, but the risk factors: hypertension, cardiovascular disease, diabetes, obesity, and chronic renal disease are the key risk factors. So if we think about those things, those are the things that who normally has to worry about? Us, African American people. Yes, ma'am. And so I just wanted to point that out because they've already identified those are true risk factors. So that's a key thing to know. Testing, we started talking about this yesterday. I just want to touch briefly on this, who's getting priority. Priority 1 testing is going to hospitalized patients and symptom. Okay, yeah, go ahead. Mm-hmm. 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 Right. Very good question. So just to reiterate, there's people with hypertension, undiagnosed and diagnosed. So you're talking about people that may be diagnosed, not taking medication, or some undiagnosed people, right? Not on anything. That reason why that's such a good question is because hypertension is such a big underlying risk factor, right? And the people that they've noticed that are taking that medication, obviously they're at high risk, but they're going to be, if this makes sense, at a lower high risk. I know, you know what I mean, because they're more Yeah, because they're more protected. But people that are hypertensive may not know it. Key people, normally young people, right? Because if they're diagnosed with hypertension, or maybe they have underlying hypertension, don't really know it, they're not taking anything, at extreme risk when it comes to this virus. Because the way the virus attacks what's called ACE inhibitor, well, ACE2, which is a enzyme in the body. This enzyme is in your liver, it's in your heart, it's in your lungs, it's in your brain, and it's in your blood vessels. So what happens is this virus specifically likes this enzyme. And so it's attacking it like crazy. And that's why we see such huge respiratory issues. But like Dr. Sanjay Gupta said, we're seeing heart issues, we're seeing kidney issues, brain, things. Remember, we talked about the neurological stuff. So all of that stuff really is important. And you got to take your medicine. But I will say one thing. When it comes to that ACE inhibitors, ARBs, the ones, the class that we talked about that some people are on, the jury is still out. The scientists still don't know. And even in this report, they say they don't know if it helps or if it hinders. But they're saying if you're on it, to continue to take it. But they're not recommending doctors use it as like therapy. So that's a key thing to know, because that affects not just the elderly, just anybody that's hypertensive. Okay, priority one, like I said, hospitalized symptomatic healthcare workers. Okay, first people are going to get it. Priority two are people in long-term care facilities, your older people, you're 65 and older who have underlying symptoms. Priority three is the community. And so you can see how important, and also in priority two is like symptomatic first responders, right? And then priority three is pretty much the rest of us, or people in a critical infrastructure. So that's how the testing is going to be done. So, which is the way it should be done, as far as I'm concerned. If you don't have any symptoms, even though we want to know, and I'm saying we should know, but if we're going to prioritize the test, that makes sense to the way they're doing it. So they're prioritizing the test, and that makes sense. And then drug therapy. I just want to get to that real quick, because I know that's something that we want to know what the heck is going on. We know a vaccine ain't gonna be ready for another year. That's out of the picture. These antivirals that we talked about and the president talked about, and azithromycin. Let me tell you something. This panel is directly not recommending you give that antiviral and that antibiotic together because of increased toxicities. Let me tell you how major that is, because our president went on and said we needed to make sure we had all of this, and the doctors need to get it, and the company need to make it. And they're saying giving those two together, absolutely don't recommend. Now, giving them apart, well, the azithromycin, that's an antibiotic, doesn't treat antivirals anyway. I don't even know why that's in there. But the antiviral, they're saying you can give it, you cannot give it. They're saying, they're not really recommending one way or the other, but they will. What they are saying is that there's an increased risk of toxicities. So there's already some countries that are pulling back and saying we're not going to use it. So I know it's not great news, but it's a little bit more informed, which means keep y'all ASSs at home. Absolutely crazy. Do not. And I know there's a lot of people that are going to open their businesses, and there are a lot of people that are barbers and hair salon owners that said, I'm not. And even though the guidelines are in place, who's going to enforce them? What's going to keep you from getting sick? I mean, are they going to take one person at a time, then wipe everything down after that person is in there, and then take the next person? And then on top of that, okay, so your stylist has still been exposed. Yeah, it makes no sense that we were at a point where we were, really doing some social distancing, trying to do the right thing. And then in 14 days, we changed it because we have, a slight plateau, but really not, because then we had a surge just the other day. So it's going to go up and down, up and down. It's a little confusing for everybody, but I think it's telling to see our president, who we know we all feel like is kind of rushing it, come and say that he doesn't agree with our governor. That's and if I'm going to agree with anything Donald Trump, is that. 2 weeks. 2 weeks. Wait until what is about May 8th, somewhere around in there. Because they say up to 14 days, right, is the incubation period, but you can start seeing symptoms as early as 2 days, but the most common is between 4 and 5. So if people start going out this week, like you said, next week, you can start seeing people with symptoms, but really seeing what's going to happen is probably within the next 1 to 2 weeks if we see another surge. And I think people need to wait and see before they go out what it looks like. I mean, it's inevitable that we're going to have a surge, right? The more people go out, that's just part of how we integrate, getting back to normalcy. But we still need to have a plan to decrease those infections as much as possible. Right. Yes, sir. Just straight up. Yes. It's gonna, well, first of all, there's a couple of things with that, right? There's us relaxing our safety precautions of what we're doing. So we're going to see uptick because of that. And people are going to personally relax. They're probably not going to wash their hands as much. A lot of things are going to change when people get a little bit more relaxed because it's gone down. And then probably we'll see an uptick. We probably won't see a real good decline until the vaccine comes out. That's what I personally feel. I'm not saying that's the only way to treat it, but I think that's the only way you're really going to see it decline significantly. But it is going to go down. It is going to go down, but we just got to be careful. And I just think right now it's just too soon. I think we just need to wait a little bit. The same thing we're facing now, us having to stay inside. It might not be as hard though then, because it'll be a little chillier. But I don't think they're going to shut down the government again. I don't think they'll do it unless the numbers get real crazy like they are now. But because it's causing so many harm for people. But in that period of time, we could be right where we are right now. It may even be worse. Mm-hmm. Mm-hmm. Straight no chaser. First of all, I believe everybody should be wearing masks. I just strongly believe that. CDC recommended it like briefly, but they really didn't stand behind it. That's just my personal recommendation. If you're not going to wear masks, okay. Social distancing still needs to be happening. You still need to be within a certain, because if somebody sneezes or coughs, those droplets can go. And they say sometimes even 6 feet isn't enough. So take that, it's going to go through the air. So just, if you're going to go to the hair salon and you feel like you got to get your nails done or whatever the case may be, make sure you wear your mask. Try to distance yourself as much as possible. Do not touch your face and all that stuff when you leave out of there. Wash your hands and take off all your clothes and all that stuff when you get home. I still recommend doing those same things. Just take a little extra precaution, because you're going to be around people that could possibly be infected and don't know it. Y'all got to stay home, because let me say this on a serious note. If you don't stay home, right, and we know it's helped us right now, but just think, people can get sick. Like, you can pass it on and be a carrier and don't even know it. And the next thing you know, 10 people are sick and somebody's in the hospital. Let me tell you, me being immunocompromised, I deal with a little bit of exercise-induced asthma. I don't even want my husband going to work, but I know he has to go and I'm fearful. So y'all just be careful. You don't know who's in good condition and who's not. Everybody that look healthy on the outside are not healthy on the inside. We got to be our brother's keeper. Let's just do better. Thank you. All right. Take care, y'all. Have a good day. Bye-bye. That was it, guys. Sorry y'all couldn't hear it. I know it was kind of so y'all know it's radio, so I can have the speaker. I have to figure that out one way so that y'all can hear what we're talking about. But you can always tune in to 104.1. If you're in Atlanta, 104.1, kiss104.1fm.com. If you're other places, and you can listen online, and it's probably nicer. But I always like to give visual if I can. So y'all have a good day. Stay safe. See y'all later. Bye. Bye, y'all.